Great looking teeth, a great smile. You may not have them now, but you could in this day of great advances in cosmetic dentistry. Dr. Frank Hernandez sees it in his patients all the time. How just a little change in appearance can have a life-changing impact.
I think that with this idea of extreme makeover, that everybody's trying to get an edge on this look. And one of the fastest ways of taking care of that situation is cosmetic dentistry. But what I do in examining somebody for cosmetic dentistry is I really take a look at what's happening to create that situation and then incorporate that in my treatment plan for the patient. I think one of the best things for your practitioner to be is a good listener. What do you really want? What do you want to achieve with your smile? One of the biggest things that I go through with cosmetic dentistry is that the bite might not be the type of bite that you can put on these nice porcelain finishing things on your teeth and get the result, because something's going to happen along with that bite later on to make a problem for these added things to the bite. One of the things with cosmetic dentistry is that if the bite is a certain way, why is the question that needs to be asked? Why did it get like that? And I think as the dentist, it's very easy to come in and say, I want to spend so much money and I want a new front grill. And what are we going to do? You know, and I think that as a dentist, I think that the dentist needs to be more conscientious of what they're giving the patient. Developmental orthodontics is an approach to orthodontics where you consider how did the person develop and how did they get to this situation, and what are the factors involved that got this child to grow and develop in this way. For example, this person is got a narrow bite, it's got some teeth sticking out, and some treatment plans on conventional orthodontics are to pull teeth. Well, I think that's not the approach that I like to take with a patient like that. I like to get that development out. Seek out what that development is in that child's growth and attack that. Widen the bite. Make those teeth fit in that same space, because that's what they're supposed to be. To get to a diagnosis to put on braces, what I do in my office is that I start off with the most basic form of x-ray. That's a panoramic x-ray. We take a head shot where we do this diagnostic tracing on that. We take a CAT scan of their jaw joint. I want to see if there's a problem with the jaw joint, no matter how old the person is. So we're going to incorporate a lot of different technology to get to a diagnosis, to get to a treatment plan. Before we even put braces on, this patient's going to go through a very extensive fact-finding situation. And I do more than what is required to get to my answer, to find out why. That's the biggest part. Answer that question why, and you're going to have a good result. With my treatment, I very rarely put braces on right away, because invariably with these patients that I see, most of these patients have developmental problems. They lack development. So we want to get the jaw to expand, to move, to grow. We want to expand the bone if we have a crowded situation. I don't use a cookie cutter approach where braces go on and it's 24 months. And that's usually the rule of thumb with it. It takes me a lot less time when the brackets go on, because those are just the finishing touches for my orthodontic situation. The transformation that some of my patients have gone through is just, it's what I want to show up for work for. You know, that's the reason that, you know, sometimes I see a very clear purpose as to why I'm doing what I do. I'll give you an example. a mom came to me, and she went to three dentists, three orthodontists, and every one of them said that your kid has to have surgery, and he was 8 years old. And she came to me and she says, what can you do for him? I says, I think I can do this without surgery. He was going to have his jaw cut and wired at 11 years old. I says, you know, this is something that I do. And we're finishing up with him right now. And mom and dad are absolutely ecstatic that their son didn't have to go through maxillofacial surgery to have this orthodontic problem done. You know, that for them to tell me that they are so happy, that they were so glad that they brought him to my office, you know, I want to show up tomorrow for work. That's it.